I would like to take the opportunity to introduce Congressman Donna Christensen, coming back from, I know, a break, and it was really great she can join us today. As you know, she's a member of the Congressional Black Caucus and chairs the Congressional Black Caucus Health Brain Trust, which oversees and advocates minority health issues nationally and internationally. She's been an advocate for patients for kidney disease and to raise the awareness of patients with kidney disease. She not only has been supportive of the Kidney Care Quality and Education Act, H.R. 1191, but has also been behind the Health Equity and Accountability Act of 2007, which seeks to improve the health and health care of racial and ethnic minority groups, in particular those patients who have CKD and ESRD. Representative, thank you.
Thank you. Good afternoon, everyone. Thank you very much for inviting me to bring greetings this afternoon for this very important and extremely timely briefing. And before I begin, I want to especially thank Kidney Care Partners for all that they have been doing and will continue to do to help not only patients with chronic renal disease and end-stage renal disease, but help people who are in need of health care in general. I want to bring greetings from the entire Congressional Black Caucus, and I'm going to take louder. I'm going to take the liberty of also bringing greetings from the Tri-Caucus, with whom we work very closely. That would include the Hispanic and the Asian Pacific Island Caucus. I also want to thank and acknowledge the panelists who are going to be here sharing information, important information with you, as well as two of the great friends of my office and resources to my office, Stephanie Dyson from DaVita and Paul Braithwaite, who I haven't seen yet, from Podesta Group. As you've heard, I chair the Congressional Black Caucus's Health Brain Trust, and with our friends in the minority caucuses, our mission is to eliminate racial and ethnic health disparities, but also health disparities for people who are poor, people who live in rural areas, and of course, any gender disparities, and because they too still exist. So we're excited about this extraordinary opportunity that we have to strengthen this nation's Medicare program and help to reduce the disparities that leave some of our nation's most vulnerable in poorer health and without access to adequate, needed health care services. As the discussions go on from here and as the Medicare package is developed, I want to stress the importance of a few issues that are of key concern to the Congressional Black Caucus Health Brain Trust, and which relate to the health care services for the tens of thousands of Americans with chronic kidney disease and end-stage renal disease. Of course, the Kidney Care Quality and Education Act is among those priorities that we all support and find is critical to the issue that we're talking about today. But first, and included there, we need greater emphasis on prevention across the board. We need to increase funding for prevention initiatives under Medicare to ensure that our nation's most vulnerable have the information and preventive care that they need to live longer, better lives. Second, we need to ensure that if we change to a bundling payment system, which we generally oppose, but if we're going in that direction, that we know going in on the front end that it will not adversely or detrimentally affect the health and health care of people with end-stage renal disease. And so we feel that this will require demonstration projects. This is especially important to us in the CBC because African Americans and other people of color are disproportionately affected by end-stage renal disease, and studies have shown that African Americans and other populations groups sometimes require higher doses of EPO in order to manage their conditions and improve their health outcomes. Finally, we need to ensure that patients and their families have the option to choose to remain in their health plans, because preserving choice as it relates to health and health care is critically important. And as a physician who came out of a solo practice to come here, that is really paramount for me, that we retain choice. And that means extending the MSP period for at least 42 months. This provision was in the CHAMP bill that passed the House, and it should be included in the forthcoming Medicare package. And we're going to work to see that it is, because it's good policy and it simply makes good sense. And with that policy would come savings that could go back into prevention. So we would be addressing two very important issues. There are other Medicare issues that we'll be focusing on, and on behalf of the CBC Health Brain Trust and the Tri-Caucus, we look forward to working with all of you to ensure that as we move to strengthen Medicare, that we do so in a manner that causes no harm, that we do so in a manner that's fiscally responsible, and in a manner that's racially and culturally sensitive as it is medically appropriate. For all of you in this room, and as for us, the patients come first. And together I know that we can do it. And thank you, and again, thank you for the briefing.
We rely very strongly on our patients to be our voice and our conscience as we do all of our activities. One of the expressions of that is our Patient and Family Council, and it's 28,000 members from all across the United States. Very pleased that I was able to join the chairman of that council today as we went around and visited various offices and are speaking to you today. So I'm pleased to introduce Dwayne Sunwald, who is from the state of Washington, who is the chair of this council, and we'll ask him to tell you a little bit about his own situation, since he is one of the people that we're talking about.
I'm speaking on behalf of the 26 million that John was talking about who have chronic kidney disease, and the other 20 Americans who are at risk and probably don't even know it yet. I'm one of the lucky ones. I was diagnosed early on with chronic kidney disease. In fact, I was diagnosed and then proceeded to get worse to the point that I was knocking on the door of the dialysis unit. And my doctor helped introduce me to the National Kidney Foundation. Through my doctor's office and the National Kidney Foundation, I started learning about chronic kidney disease and found out that I could make some lifestyle changes. One of the minimum changes that I made was diet. After 18 months of pharmaceutical treatment, I was slowly getting better, but not much. And in fact, my creatinine level kept rising. So I changed my diet, and within 2 weeks, I started feeling better. Drugs could not do that for me. And today, I went from a creatinine level of 4.8 to 1.1. I'm actually in remission for a period of time, which I hope will be the next 45 years if all goes well. Okay? But millions of others are not as fortunate as myself. They will experience medical emergency and end up on dialysis. As a teacher, I actually had a student 2 weeks ago call me and said, I haven't been in class, I was in the ER, and I was on dialysis, all within 24 hours. Had no idea I had kidney disease. And I went, oh my gosh, you're exactly what I'm going to be talking to people about. So I know firsthand the importance of early detection because I was lucky. My student wasn't. She has to make treatment options rather quickly and make decisions rather quickly without much of a learning curve. And that's scary for a lot of people. In fact, for millions of people, and their future depends upon it. Congress can do something now to help kidney patients long before they reach a critical stage and be like one of my students. After they become dialysized, that's the critical stage for kidney patients. So by passing the S691 and HR 1193, this important legislation will, one, provide Medicare coverage for kidney patient education, which is crucial, to learn about dialysis, to learn about transplant options, and the management of the complications of chronic kidney disease for a patient. Kidney disease is not an individual disease. It affects the whole family. The second thing this legislation can do can help increase awareness and research through chronic kidney disease demonstration projects. It can also require training and certification for dialysis technicians. It can also explore barriers that keep patients from dialysizing at home. Together with the National Kidney Foundation, I urge Congress to enact this legislation that will help identify Americans with kidney disease before they experience kidney failure. Lead them to better health by preparing for dialysis, provide incentives for quality improvement in dialysis care. These changes will not only improve outcomes and overall health, but also ensure that kidney patients will be able to contribute productively to communities across America. I am a living example of that education really does work. And the sooner we educate these patients, the better off and the healthier they're going to be. Thank you.